The middle superior alveolar nerve block is indicated for pain management of both premolars in a quadrant. The clinician will utilize the second premolar at the height of the mucobuccal fold to identify insertion location. It is helpful to confirm that you are well away from the periosteum when inserting the needle. The angle will be approximately 20 degrees to the long axis of the root of the tooth. For both the MSA and PSA, it is helpful to run your index finger along the zygomatic process to confirm its location. A probe can be utilized to identify the depth of penetration for the MSA injection, which is approximately 3 to 6 millimeters. Studies have reported the absence of the MSA nerve branch in somewhere between 50 to 72% of individuals. This may require you to utilize additional local anesthetic for pain management. Retraction will again include the index finger and the thumb, stabilizing the cheek outward and upward. The clinician will loosen the cap with one hand, provide stability with their ring finger, carefully approach the patient, and identify the penetration location above the maxillary second premolar. Extended verbals for the middle superior alveolar nerve block. The medical history has been reviewed and there are no changes. The vital signs are within normal limits. There are no contraindications for local anesthesia. I will be utilizing 20% benzocaine topical for 1 to 2 minutes, 2% lidocaine with 1 to 100,000 epinephrine, and an expiration date of November 2018. I will be utilizing a 27 gauge short needle. The injection is the middle superior alveolar nerve block. This anesthetizes the pulpal of the premolars, potentially also the mesial buccal root of the first molar, as well as the buccal soft tissue of the affected teeth. The insertion site is at the height of the mucobuccal fold at the second premolar. The depth of penetration is approximately 3 to 6 millimeters. The deposit site is well above the apex of the second premolar. The landmark is the second premolar. The pathway is 20 degrees to the long axis of the root, no bony contact. The dose range is approximately 0.9 to 1.2 milliliters. Complications may include hematoma, edema, and pain at the site. It is always important to communicate with patients and faculty. Encourage patients with positive feedback. With faculty, state when you have reached your landmark. State that you have aspirated and the results twice, which would sound like aspirate, negative, rotate, aspirate, negative. Then state when you are prepared to deposit your solution.